Hooklying hamstring bridge with a posterior pelvic tilt and a low reach. So basically what we are doing in this exercise is you have a 90-degree bend in your knees, about a 45-degree bend in your waist here, in your hips. What we were trying to do is we were trying to use the pelvis, so we are using the hamstrings and glutes to bring the pelvis into a posterior pelvic tilt, help kind of stack your rib cage over your pelvis here. So this can be helpful if you tend to have an excessive anterior pelvic tilt, meaning your pelvis is tipped forward, low back tightness, difficulty feeling like your hamstrings are always tight, things like that. So this can be helpful to kind of just basically you're changing the input to your nervous system. So we're using your muscles to kind of change the orientation of your pelvis, and this can just help your nervous system to access this new kind of alignment or position and just feel what it feels like, which can help you over time and help decrease pain or tightness in areas that you are having. So we are going to have something to squeeze between your knees. You are going to imagine you have a bug underneath your low back, and you're going to tuck your pelvis under to gently squash that bug. Pull back on your heels as you gently just lift your tailbone from the floor. Okay, so I'm not lifting a ton here. Then with my hands, my palms are facing up. I'm not all the way up at 90, I'm at about a 45-degree angle. Here I'm reaching. I'm going to inhale through my nose. Exhale through my mouth, all the air out. Pause at the end with your tongue on the roof of your mouth. Inhale through your nose silently. Exhale. Reach all the air out, feeling your lower abs and obliques kick on at the end of your exhale to bring those ribs down. Pulling back through the heels to engage the hamstrings. All the air out, keeping tension in your abs as you inhale again. So the key here is proper setup. So like I said, you're pulling back with your heels to engage the hamstrings. You're trying to squash that bug there, gently lifting the tailbone. That's that posterior pelvic tilt, using the hamstrings slightly, kind of you're just holding on to the ball or what you have between your knees. As you exhale, you're exhaling all the air out. Get all of it out. I don't want any short exhales. I exhale long and slow. Get all the air out, feeling your lower abs and obliques kick on as you reach. Here, and then pausing before you inhale again, and then as you inhale you should feel your rib cage expand there, so keep some tension in the abs as you inhale again. So what you can do then after doing this exercise is maybe you retest one of the tests like the toe touch or the squat or bringing your knee up to your chest, and see if it feels any better. So after doing maybe 3 sets of 5 to 10 breaths here, you can retest one of those movements and see if that feels better.